Hi, I'm Dr. Woffles Wu. I'm a plastic and craniofacial surgeon. I was trained in Singapore, Melbourne, the US, Japan and Thailand, and I practice completely now in Singapore, although I do travel occasionally to Shanghai and Hangzhou to perform operations there. My specialty is facial aesthetics, both the prettification as well as the rejuvenation of the face, and I also specialize in breasts and body contouring. So I've been in practice for 33 years, and in that time I've developed certain things in the industry. One of them is the facial aesthetic scale. It's a very simple scale that any doctor can use, any patient can use. And we basically have a line which goes from 1 to 10, and every face can be placed along this facial scale. Now, what we've noticed is at the lower end of the facial scale, people tend to look ethnically very different. So an African or an Indian or a Chinese looks characteristic to their ethnic origin. However, at the upper end of the spectrum, the 10, 8, 9, 10 region, faces begin to look the same, and this is what we call the universality of beauty, because beautiful faces of all races begin to look the same, yet still retaining some ethnic differences. Now, what are the commonalities of a beautiful face? It's a nice egg-shaped head and a sharp pointed chin, big eyes, a smooth round forehead, a petite nose, and nicely balanced lips. So whether you're looking at a movie star from the West or you're looking at a movie star from the East, they all kind of embody these qualities. And the chin is one of the most important things. The eyes are the second most important thing when you're looking at somebody's face. An epicanthoplasty is a small surgical procedure that utterly transforms the shape of the eye, especially the inner part of the eye. And why we do this is because if you look at the Oriental population, we were originally thought of as having an epicanthic fold. However, if you look at all your friends, if you look at a lot of Chinese or Oriental people, you'll find that there are different eye types, and there's some eye types which look very similar to a Caucasian eye. And invariably, those eyes in a Chinese face will make the face look very attractive. But it's not about westernization of the eye. Now, if you look at a Western eye, it always has an open medial canthus, so they don't have epicanthic folds. Epicanthic folds really belong to the Oriental population. But as I said again, not everyone has an epicanthic fold. In fact, if you look around at your friends, it's quite difficult now to be able to find somebody with a very classic epicanthic fold and a monolid. Most Asians actually do have a double eyelid, whether it's high or low. So an epicanthoplasty is a very popular procedure where we are trying to make the eye more elegant, longer, a little bit wider, so that it makes the face look more attractive. About 20 years ago, I developed my own procedure, which is an advancement Z-plasty, where I create a triangular flap that cuts behind the epicanthic fold, and then I make a little V and move this V to a higher position close to the nose. So there's only one visible scar, and most of the time that scar disappears into the double eyelid of the upper lid. So we now can get a narrow, rounded kind of Oriental eye, more like an almond shape, which definitely looks more elegant and more attractive. The thing about an epicanthoplasty is, whilst it's a very small kind of operation, it's quite complicated, and there are many little steps and maneuvers that need to be done within the operation itself, even though it's a tiny, tiny little area on the eye. And I would probably say that some of the mistakes that I encounter is that the epicanthus isn't open enough. That means surgeons who are maybe not used to doing this procedure may be a little timid at making those flaps. Now, in my case, most of the patients who come to see me want to have that transformation. And it's very interesting because all the Oriental patients that I see, they don't come to me saying that I want to look like a Westerner, but they want to have that end of the facial spectrum that we talked about, where you still look ethnically Oriental, but you have all the nice features that make for a 8, 9, 10 on the facial aesthetic scale. So if you look at the Oriental eye, we have classified 6 subtypes. Type 1 and Type 2 look very much like Caucasian eyes, where you get a parallel double eyelid fold and you get an open medial canthus, which is kind of rounded. And it kind of looks like an Western eye. Then as you get to subcategories 3 and 4, you'll see the formation of a little fold, and that's the epicanthic fold. As we get to category 5, that epicanthic fold becomes more prominent, and category 6 is where that fold from the upper eyelid comes down, crosses the midpoint of the eye, and then recurves into the lower eyelid. So it looks almost as if there's a web at the beginning of the eye. So with my Epicanthoplasty technique, which I've been doing for over 20 years, what I've discovered is that I can vary the size of the triangle and the flap rotation, and we can bring a category 6 to a category 4, or we can bring a category 4 to a category 2 or 1. So we have a range of epicanthoplasty results that we can achieve using just this one technique. It's just a question of whether you open the door widely or you open the door just as a little crack. And a lot of that will depend on what the patients want. So if you're considering an epicanthoplasty, there are many surgeons who provide different forms and different styles of epicanthoplasty. It would be in your interest to go to them, ask to see some of the before and after pictures that the surgeons have, and then you'll get an idea of the aesthetic sensibility of that doctor. And then you choose accordingly.